There are currently 1.4 million residents in nursing home care. About 88% of those residents are over the age of 65, and most are enrolled because of physical or mental needs that require the help of a skilled nursing staff. Catholic Health Services of Long Island strives to offer the best in care for its residents, focusing on returning you or your loved one to healthy, productive, and fulfilling lives. Whether it's short-term rehabilitation after an injury or illness, or you're looking for long-term care, join us today to learn about how your decision to choose a CHS facility can make all the difference in your quality of life. It's all on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone. Thanks so much for joining us. I'm Jane Hansen. In addition to long-term care, nursing homes provide a cost-effective way to enable patients with injuries, acute illnesses, or post-operative care needs to recover in an environment outside of a hospital. While many facilities offer the promise of recovery or stabilization, CHS nursing home residents are ensured that their quality of life is of utmost importance to their caregivers as well. Joining me today to discuss some of the programs and therapy services at the St. Catherine of Siena Nursing and Rehabilitation Care Center is Mary Sue Schultz, their Director of Recreation, and she's brought along some of her friends here today. Welcome, Mary Sue. Thanks so much for being here.
Thank you.
What does that mean, the Director of Recreation?
Recreation therapy is one of the services we provide at the nursing facility. We kind of focus on the pure quality of life, enjoyment, and doing things that the residents love to do, used to do, introducing them to new things, providing them care and comfort to make their quality of life at its highest level.
And that's really changed in the last few years because you guys, I mean, this is true, you have no antipsychotic drugs in use for your long-term care patients?
I'm very proud to say over the last few months we have reduced them to zero. Not one of my long-term care patients receives an antipsychotic drug.
So what do you do in place of that?
Well, we've worked really hard as an interdisciplinary team to come up with alternative comforting measures. So I brought some of our things that have been successful. We try things that kind of stimulate a comfort thing. What I've noticed with my residents over all the years I've been doing this, the things that stimulate them to the most comfort level are babies, animals, prayers, and music. So we started with some animals. We have our perfect pets, which simulate breathing. They sit on their lap, they can pet them, provides them a comfort just as if it were a real animal without all the side effects of a real animal. We've also started essential oils. So we have these pendant diffusers that we give specifically to each resident based on what they want. We put an essential oil on there and it goes right within their respiratory circle. So I can use wild orange on somebody, I can use lavender on somebody else, I can use frankincense on another person, but the possibilities are limitless because essential oils are so vast in what they treat.
So it's really holistic.
We are trying very hard to have much more of a holistic presence because medications all have side effects. So the least we can use, the best quality of life for our residents.
And I would assume that it means that there might be more energy because drugs can tend to make people very sedated or
absolutely
lack of energy.
We're on to reducing anti-anxieties. That's our next goal as best we can, and I've had 3 great successful reductions with a amazing increase in alert level with 3 of my patients that I can recall right off the top of my head in the last month.
What do you mean amazing differences?
They're more responsive, they stay awake longer, they're easily engaged, their speech is more fluent, they're more spontaneous, and sometimes it's just being aware and starting with little different things. There's also essential oils that increase alertness as well, so we'd like to use that for people who maybe have more periods of lethargy through the day.
Mm-hmm. So now let's talk about the differences between the long-term care patients who are probably going to be there for the rest of their lives, and then the short-term people that are there for rehabilitative purposes. So Do you use any of this kind of therapy with them?
Absolutely. We really try to discourage using sleep aids for anyone, especially those going home. I've used lavender for several rehab patients instead of the Ambiens or the Xanaxes because those things will just make them lethargic, more easy to fall, loss of balance.
Oh, yeah.
So we actually had one of our rehab patients, she discontinued her Ambien because her lavender necklace made her so comfortable. So I was very proud of that, and we offered up to people, we also offer them melatonin, which is a natural hormone that we all produce, as opposed to a medication. So we're really trying to encourage people not to use the drugs unless absolutely necessary.
I think I could use one of those lavender pendants. Help me sleep a
too.
little bit better. So how long is the typical rehabilitative stay?
It can be anywhere from 2 to 6 weeks. Some people will be with us 3 months, some 6 months, but it's all according to what they need, sometimes according to what their insurance company wants to cover, but usually 2 to 6 weeks.
How is this? I mean, it sounds like there's just been enormous changes made. I mean, my mother was in a nursing home for a while, and the things that you're talking about doing, they were just beginning to start that 3 or 4 years ago when she was there.
Mm-hmm.
So those changes are really important to our society as a whole.
Absolutely. As a different age group comes into long-term care, you have to go with what their needs are. The music changes, the way people utilize electronic equipment is very different. Social media is huge. iPads are the greatest gift to get your grandparents now. Those are all things, iPods, they're all great options. So you have to change with what your population needs. It's very different than it was 20 years ago.
Boy, I guess. So you've got grandma and grandpa that are there on the computer or the iPads and staying in touch with their college-age grandkids. And
absolutely. Skyping, Facebooking is huge. Now all we have to do, I guess, get them on Tumblr and Vine, and they'll be with their grandkids more often.
I love it. Well, great work. Thank you so much, Mary Sue, for sharing all this with us.
Thank
you to your little furry friends here. We're going to take a quick break, but when we come back, more on CHS's nursing home services, and one patient will tell us about her recovery. Stay tuned. Welcome back to CHS Presents Lifestyles at the Heart of Health. I'm joined now by Kristin Trone, the Assistant Director of Recreational Therapy at Our Lady of Consolation Nursing Home and Rehabilitative Care Center, and Michelle, who is a former patient of the center with an amazing story. Thank you both so much for being here today.
Thank you.
Kristin, tell me the story of how Michelle came to you and what kind of shape she was in there then versus now.
Well, when Michelle came to us, it was about 2008. And she came from another facility that was much further away than West Islip. Her family lived in Massapequa, so they would be driving much further to see her. So she moved to West Islip, and she was in a recliner chair. She could really not talk too well, really couldn't sit up, couldn't do much by herself.
But now she's doing so much better. So it's been wonderful for you at Our Lady of Consolation, I assume.
It was the best move I ever made.
Now you had a stroke.
Had a brain aneurysm
A brain aneurysm?
that led to a stroke.
Oh, and it was Christmas Eve. Boy, that's some Christmas celebration. Whoa. And you have 3 children. And so now the kids have been able to visit you and spend some time with you, and you're living at your sister's home, so you're in a whole different place.
It's been wonderful.
You've kind of got a bit of your life back.
Yeah, I lost 5 years of my life, and I just got it back on May 13th.
Fantastic. Now, Kristin, one of the ways we talked earlier with Mary Sue about how the new media, the use of technology is really helping patients like Michelle. Can you describe that for me?
Sure. The use of iPads, cell phones, tablets, it's come a long way from years ago. And with Michelle, we gave her the iPad, and she was able to talk to her kids, email her kids, Skype her family. She used Facebook a lot, which a lot of our residents now are using. Even the older generation, we're teaching them how to use it, and they're connecting to their family across the country.
And how important is that sense of connection?
It's huge. Family is the most important thing. And to be able to talk to your family when you're not with them is just amazing. It keeps you connected, keeps you together. You know what's going on in their lives. They know what's going on in your lives. And it's just, it's quality of life. And it's so important.
It is the quality of life. And you even had in your room, when you were there at the center, you had Wii for the kids?
Yep, we have Wii games, and we would leave the Wii system in Michelle's room. So when her kids came over, they would visit her, and they would put the Wii on the television and be able to play Wii bowling.
Wii bowling? Okay, who won? Were you getting good at it?
Never me.
Well, we had the privilege of actually accompanying you recently when you went back, and of course that sense of community just prevailed at Our Lady of Consolation to learn more about all the treatments you had there. So let's take a look at that now.
Hello, my name is Michelle McMullen, and I'm here today partly due to the wonderful care I got at Our Lady of Consolation nursing home. I've been in so many different facilities, and this by far is the best. I have never met a kinder group of people that really love what they do, and they care so much about their residents. They took wonderful care of me. 7 years ago this December, I had a brain aneurysm on Christmas Eve that led to a major stroke. When I came to Our Lady of Consolation, I couldn't even sit up straight, and they worked with me, so now I can even stand up and hold up my own body weight and take a few steps. The other facilities I was in and the hospital told my parents that I would never talk, I would never feed myself, and I would never walk. And today I'm doing all three.
Having a stroke, there's a variation of how far she can go as far as progress with physical therapy. Obviously, she progressed to the point where she got to go home, but initially it looked like it was going to be tough. She couldn't do a lot for herself. She's kind of sad, scared, not knowing what was to be, struggling with missing the kids. So that in itself, being a young woman and being independent and then going to be dependent, definitely put a toll on her.
I know, the doctors told my mom that she was never going to walk and she was never going to talk. But I mean, she's definitely got the talking down, and she's slowly learning how to walk again. She's definitely gotten a lot of improvements since she's come here. Out of all the places, this has been probably my favorite because it's the closest and the people are the nicest here.
They were always there to give her medicine, and they were all very nice. Whenever I walked in, the security guards were always there, and we would always joke around with them. Like today when I walked in, they were like, "Oh, you got so tall now," and stuff. So we were always friendly with them. And the aides, we all my mom always introduced us to them, and we always had conversations with them and stuff. I always felt comfortable here.
Our Lady of Consolation, I personally think, is the best nursing home, but it's a home. We make them feel very at home, very relaxed. Try to bring in as much of home as we can.
I feel that we are immensely privileged to work at Our Lady of Consolation because as part of Catholic Health Services, we're afforded the opportunity to apply our skills, our knowledge, our training, our ingenuity to go beyond just building muscle and restoring balance, to take it to the next level, to enter the realm of restoring lives. And Michelle and her beautiful family are a prime example of that principle. We do so much care about what happens with our patients, and they become part of our family, our extended family, but our family nonetheless. It makes us very proud to be part of your life.
Everybody was just so kind and supportive. It was like a family. And when I went home, it was kind of like bittersweet because I was with them for so long. They became like my family. So it was hard to leave them. But it was nice to be home with my whole family.
So you actually were in a walker and taking steps. That's amazing.
I've come a long way.
Yes, you have, and I understand you're the jokester of the place.
Oh, yes.
Always a smile. How do you keep that happy feeling? How do you stay so chipper?
I could either be paralyzed and miserable or paralyzed and happy. And it's more better to be happy.
I firmly believe that with all my heart. You wrote this thank you note talking about modern technology. You wrote this beautiful email when you were leaving the center, and you said, they told me at the beginning that they were in this with me for the long haul and haven't wavered since. Although I'm excited to get on with my life, it's kind of bittersweet. I will definitely miss the friendships. Thank you, one and all. It's just such a wonderful note. That sense of community, how important is that, Kristin?
It's very important, especially at Consolation. We feel that family's important, staff is important, and we all work together. It's success, and that's exactly what Michelle is.
Mm-hmm. And now your children, how are they noticing all the differences in you?
They're very excited that I'm home. I love to see them every day.
I bet that's a huge change because you didn't see that for a long time.
Right.
Thank you so much for sharing your story with us. We really appreciate it, and continued good luck to you and much success, Kristin. Thank you for all the work you do.
Thank you.
Thanks.
We're going to take a quick break, and when we come back, we are going to have more with CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. As we continue our conversation on the wonderful services offered at CHS nursing homes, we're now joined by physical therapist Steve Connor and chaplain Stephen Ott, both from Good Samaritan Nursing Home, to talk about all the continuing care services offered there. Welcome. Good to have you here.
Great to be here. How are you?
I'm good, thank you. And I understand you have a fan club watching.
Oh, definitely.
We would love to say hi to everybody at Good Sam, our staff.
Hello.
And residents and volunteers.
Do you do like a little song and dance for them all the time?
Oh, we do. We go into people's rooms.
That's right.
You know, we always have like arm wrestling contests to see who goes in first.
He often wins.
Of course he wins.
He often wins, yeah.
What? Okay. Now, well, but to think about this, a physical therapist and a chaplain working in tandem, working as a team, it's not something that I would have automatically thought about.
Right.
So how does that work, and what do you each bring to the party?
Well, you know, the ministry of Jesus was both physical and spiritual. So we feel that working together is a great combination. You know, I'm able to work with people as they come to the residence to assess them, to find out where they're coming from, and to take part in the healing process, which Steve facilitates as well.
And you do that, obviously, from the physical standpoint.
Yes. When anyone comes into the nursing home, whether it's long-term stay or short-term stay, there's always a grievance stage. There's a loss of independence, a loss of function, and a temporary loss of a home. So what we do is we provide spiritual, emotional, and physical support and try to improve that person's quality of life and reach their goal of either returning home or maximizing their independence.
I've never thought about that before, about that grievance stage for them, because sometimes, particularly if they're for long-term care, it just seemed like a natural evolution that they can't be in their own homes anymore. But that's a terrible loss for them, isn't it?
Absolutely.
Yes.
And okay, so you said that you assess them and then you help them with all of this. How do you help them get through that?
Well, one thing, we want to make it more personable with them. We want to make it fun for them. Any activities that they do, we kind of like interview them in the beginning. What do they like to do? If they like sports, we try to talk anything that they're really comfortable with. We actually make activities that improve the trunk control, the posture, strengthening. We can do everything with making it fun activities.
Mm-hmm.
So we can do anything as simple as a ball toss, or just even, just making it fun with basically anything that we can do.
Sure, and the capabilities have got to be so different, though, because, I mean, you've got such a wide range of what people can or cannot do.
Right.
So everything has to be really personalized, I would assume.
Yes.
Which is a lot of work. And then from a spiritual standpoint, I know we've been talking a lot throughout this show about the sense of community at all of these centers.
Yeah.
That really rings through for you in particular.
Yeah, we have one spiritual community. I read a prayer in the morning over the loudspeaker, sometimes at night, and it's shared with everyone. We have an interfaith spirituality group, so everyone in the residence shares in talking about their experience, because it's very common, right, that they miss their families, their life is changing, and they wonder what that means for God. So we share those things with each other, and also with each other as staff members, too.
We should point out that somebody doesn't have to be Catholic to be in these centers.
No, we welcome people of all faith because, that's respecting their dignity and respecting their spiritual belief, which is we serve each person. When
they first come in, are they concerned at all about that?
I don't believe so. I haven't heard that voiced, but I think it's a really good thing to bring up, that we proceed from a Catholic ministry. But part of being Catholic means we welcome people of all faiths, and we want their faith both to be celebrated and respected. So we've partnered with ministers and rabbis in the community to come and visit people to sort of speak to their specific need when I can't do that.
Mm-hmm, exactly. So let's talk about this in terms of short-term care. When you're dealing with somebody who's going back to their own home, I'm sure safety and having a successful recovery is paramount on your mind. So how do you deal with them? How do you help those people in particular?
Well, everyone is individual specific. So when they come into the facility, we perform interviews. We find out whether that person lives alone, lives with a loved one. We get the families involved. We find out what their prior level of function was, and we implement the program to help develop what they need in order to return home, whether it's with assistive devices or just with pure strengthening, balance, training.
And helping them spiritually too, I'm sure.
Yeah, we really try to make sure that the spiritual life of each person is maintained and can even grow, so that when they come to the residence, I have time to work with them and to see what their spiritual struggles are. Do they feel that God is part of their struggle? Do they look forward to coming home? Are there struggles they face at home? And we really try to put that all in the ministry, and also really including the family members, because they're going to be received by caring family members, and we want to be sure that they're supported as well.
What about people who don't have families or whose families aren't there for them?
It's a difficult challenge. We make the residents a community. I have spiritual care volunteers that work with me, that we try to really provide a sense of spiritual family to each person, so that though they may not be visited by family members, they're given that connection and that personal care that I think is very important.
And how important are things like music and that sort of thing in what you do? Do you get involved in any of that?
It's very important. It's very important for the person to be comfortable and feel like they're part of something. So music, if they, whatever music they like, we individualize to what their likes are. Again, certain topics, sports, politics.
So it's politics. Oh boy, you guys take on everything there. God and politics.
Yeah, that's right. We're the courageous nursing home. We go for it all.
So any last words to people who are watching this who might say, you know, we don't know how to handle this situation of our mother or our father or somebody very close to us going into one of these facilities and perhaps being there for the rest of their lives. What can they do to make that transition so much better?
Again, we consider it not a facility, but we consider it a community. And we welcome everyone to come in. And everyone who works there, who lives there, we're all part of one family.
And I would add to that to say that I would recommend to all families to look at ways you can be involved with your loved one's life in the residence. We invite people to come to Mass with us. We invite people to come to the Interfaith Spirituality Group. You know, we invite the involvement of the family members, and we're also there to help heal if there are problems. So that's what I would say, is to really seek out the people, you know, the staff of the residence you're looking at, and find out how they can help you through the transition, through all the transitions of life.
So thank you all so very much for being here today. I really appreciate it. And of course to all of our other guests for sharing their knowledge and their stories. For more information about CHS, you can call 1-855-CHS-4500 or visit chsli.org. Thank you for joining us today. I'm Jane Hanson, wishing you goodbye and good health.